Welcome to Keeping It 100 Coalition Conversations, the official podcast for the National Coalition of 100 Black Women Metropolitan Baton Rouge chapter. I'm your host, Shanice Lewis, and today we are spotlighting HIV and AIDS awareness. Baton Rouge currently ranks fifth in the nation for HIV diagnosis rates, making this conversation vital for our community. We're honored to welcome two extraordinary guests, Velanie Taylor-Orange and Marvin Anderson. And we're going to talk more about the work they're doing in the community and upcoming events for World AIDS Day. So let's welcome both of our guests to the show. Hi.
Hello, everyone. Thank you guys so much for having us.
Now, let me tell everybody a little bit about you both. So, Velanie, you have been advocating for individuals living and winning with HIV/AIDS for the last 11 years at Family Service of Greater Baton Rouge. And you are currently the Prevention Director, Ryan White Part A Intake Coordinator, and Medical Case Manager. And through your many achievements, your greatest joy is being a servant. And I see you are also a member of the Sigma Gamma Rho Sorority Incorporated. So we are excited to have you on the show today. And Marvin is one of the most popular advocates in Baton Rouge on this topic. And he served for nearly 2 decades through his diverse platform as an award-winning empowerment speaker, dual certified life coach, and mindfulness coach, author, public health advocate, and ambassador. He is the CEO of Live Higher Inc. and a lifestyle empowerment coach, consultant, has a consulting agency. And in 2017, after being personally impacted, you became empowered to add HIV advocacy to your public platform, and you are on many boards and you're doing many things in the community in which we want to get into. But first, now I can hear myself. Somebody must have their speaker up kind of loud. I hear myself talking back. Can y'all hear me or echo?
I'm not sure. I don't hear echo, but I definitely hear you loud and clear.
Okay. So Velanie, I'm gonna start with you. Briefly tell me about Family Services of Greater Baton Rouge. I see it's a nonprofit organization, but then I also saw y'all were on the City of Baton Rouge website as well. So tell me how that works and what you all do.
Yes, ma'am. So Family Services of Greater Baton Rouge has been servicing the wonderful area of Region 2, which is primarily Baton Rouge and surrounding parishes, since 1955. We have been in the prevention program since the 1990s. We provide multiple services, of course, free HIV, syphilis, and Hep C testing. You get your results within 20 minutes. No ID or anything is required. Again, we're a nonprofit, so we don't charge for anything. We are what you call a status neutral location, meaning that not only do we provide assistance for those individuals who are positive with HIV or AIDS, we also assist those individuals who come up with a negative result as well. So we have PrEP that we offer. We have PEP that we offer. We have a fully functioning clinic. We have three physicians on staff. We open every Tuesday, Thursday, and Friday. And we provide like all medical services. We've recently just started doing a weight loss clinic as well. We also have a fully functioning lab. I'm actually one of the phlebotomists on staff. We also have a contract with DCFS, where if you have any type of case, we have more of the milder cases. The milder cases. And those individuals come in for like drug screens. I'm also one of the individuals who does the drug screens as well. And with the intake process, anyone who is in fact positive, it is my job to get them into care and to get them a case manager. So when I say I work on all realms and family services, everything from the counseling, I work in the
Look
back
like
of
you're
the
doing
counseling.
everything. You do food sometimes too, and clean up
You know,
sometimes too.
yes, ma'am. One thing my mom always taught me is to always learn all areas of a job, because you just never know what God got in store for you. And that's exactly what I've done at family service. If they ask me to do something, I try my best to do it. I've never been one to to avoid failure, because I feel like that's how you learn the best. So, but let me tell you, I ain't even finished. We also do custody evaluations. We do supervised visitation. We have a parenting center. And with the domestic violence courses, we offer for victims of domestic violence. We provide immediate shelter as long as proof can be provided. And for those individuals who are in fact the offenders, we provide counseling sessions. So as whatever the judge orders for amount of classes, we can offer those to those individuals. Now there is a minimal fee for them to get those classes, but we work on helping any and everyone. So I say family service is one of the best places. I have learned and grown so much from this agency. It's unbelievable. Just the great work that we do, the great people that are there. But I can go on and on. But yeah,
Well,
family
are your
service,
services for
1955.
low income, or you could go there with insurance? Is it for just everybody in Baton
Oh
Rouge, or
yeah,
specifically
anyone.
in need?
Uh-uh. Anyone. Yes, ma'am. Anyone. Yeah, we don't turn on anyone. In fact, we recently hired an interpreter. So now we're able to assist those individuals with a Hispanic background as well. So
So I'm
yeah,
gonna
we offer relay services when needed.
I'm gonna pose this question to both of y'all. So tell me, how did you get your start in HIV and AIDS advocacy? You want to start, Marvin?
Sure. First of all, thank you for having me, and I'm really happy to be here. And I'm happy to see the sisters from 100 logging on, because a lot of times people don't engage, so I'm happy to see them logging on. So my journey began years ago. Actually, we were both in Los Angeles at the same time. Shanice and I, at that time, I did not have a diagnosis, but I felt compelled to do the work. But it was years later when I did receive a diagnosis. Um, I didn't want to do the work because of the stigma, and it was automatically connected to, if you do the work, then you have a status. Well, I was doing empowerment and advocacy and coaching, and I was going out speaking and telling everybody, live your best life, live your truth, live authentically. But I had this secret, I had this shame that I was carrying, and so I went to this conference, and it was a conference with advocates, any comorbidity you can think of, and I was there, and they were just going hard. And I came online on Facebook, and I shared my story, and after I shared it, I got on the elevator, and this voice was like, "You crazy? You better go take that down, and you you better go take that down right now." But I didn't, and I got so much feedback and so many inbox like, "Thank you for helping me," and one specific one, because I was also in ministry. One specific one was from a pastor, and she said, "Call me." So when I called her, she started crying. I was like, "Well, why are you crying?" And she said, "Because you've come to my church, you've done meetings, you've done revivals, but I never thought you would be my support for this. I have a family member who just came to me and shared their status with me, and I didn't know who I was going to go to." And it was at that moment that I realized that even after a diagnosis, that there was purpose. And so that's how I got into the work. And that was in like 2017.
And what about you, Velanie?
So I started at family services in 2013 or 2014. Unfortunately, I did not start on the Ron White side. I actually started in the back building as the secretary, the receptionist. I was answering the phone. And luckily, our executive director, Miss Renee Taylor, she saw how fast I could catch on. She saw how fast I could multitask. She saw how fast I navigated to clients, making sure they had all the services they need. So in the midst of that, I was in the process of getting my master's degree. And then once I got it, she was like, "Hey, I have an opening for a case manager under the Ryan White Part A program. Would you like to apply for it?" I'm gonna be honest, I had no idea what that even was. And I was like, you know what? I'm gonna just step out, let God do what He do, and I did that. And when I say it's been so eye opening since, I went from just a case manager to the intake for all case managers to started doing the testing classes. I tested for like 5 years to where God opened up another door to where I can take over that program in family services dealing with all prevention aspects. So just nothing but God's grace. just doing the best, no matter what the job was. I made a point to give it 110% every single day. And God doing, shining his light, allowing other people to just see the work, see the dedication, to see that I genuinely love people. I genuinely love serving folks. And I think that goes a long way, especially with this field. You have to have a passion and a desire for it. Because if you don't, it's going to show. It's going to show. So I hope everything I've done so far is very, very much heartfelt, and it always shines all my days. But yeah, but that's how I started the family services.
So, in your personal opinions, why do you think the rates in Baton Rouge and HIV are so high?
The rates, well, I could say this from my end, they are high, but what's not explained is that we test a lot here. So by us testing a lot here, our numbers may be higher. But let me tell you, I'm fine with us testing more and our numbers being higher as long as we're able to get those individuals into care once they being tested. So I think that's part of it. And then two, stigma, um, a lack of access sometimes, um, a lack of funding, mental health. All those things are imperative to this work. So I think that's part of some of those issues.
What do you think, Marvin?
Um, I think all of those things that Velanie just shared, but there are a lot of things that coincide, that intersect, that make it a larger issue. Number one, we're in the South, and we're in the Bible Belt, and because we're in the South and we're in the Bible Belt, then stigma um, is heightened, and that's because in the South, in the Bible Belt, we look at um, HIV as a moral issue and not a health issue. And so that carries stigma. And I always say that HIV is not the epidemic or the pandemic, but it's stigma because that lends to the continuum of HIV. And so that's the first thing. And then also in the South, we have a lot of red states. And so that limits accessibility to healthcare. And it looks different for people who are more impacted, like Black and Brown people, like all of us who are here this evening. In the South, African Americans or Blacks make up for about 26% of the population. However, in the South, we make up for 54% or more of new diagnoses. And so it's systemic. It's systemic, and we have to look at it for what it really is. And then finally, it's all of those things that hinder people from getting into medical care or health care. And so I think there's all of those things that matter. But I think one of the major driving forces is the stigma that exists.
Do you think poverty has something to do with it as well?
Oh, absolutely. I think, when I say systemic, that means poverty, lack of health care, um, all of those things that lend itself to systemic systems that affect marginalized communities, disenfranchised communities like Black people, then all of that has everything to do with it. So, absolutely.
So, what challenges do you have when you go into the community and try and educate people and try and bring resources? What are some of the challenges that you face?
Um,
Um,
Go ahead, Miss Velanie.
oh, so I think one of the things that we have is just the backlash of it all. Just I don't want to say ignorance, but just the not knowing. Some individuals still saying, "Oh, this is a gay man's illness," when we all know that's not the case at all. Ain't nothing wrong with me. And like Marvin say, stigma. Oh my God, that is the biggest. If we can find ways to deviate this whole stigma thing, I think it'll help across the board. I think sometimes funding can be an issue. Um, Making sure we have constant access to proper medical equipment. Um, I know at one location we tested, they on one particular brand of condoms, when all of them do the same thing. Just a mindset that we have as a people. We have to work on that because we are negatively affecting ourselves. So I think that's some of the issues that we're having. Is just the stigma and just not knowing.
Yeah, and I think in addition to that, some of the challenges is awareness and knowledge, and you'll be surprised. Spaces that I go in and have conversations about HIV, people think that it's not an issue anymore. Secondly, individuals think that it is still a gay man's disease, and that's certainly not the case. As a matter of fact, right now in 2024, it used to be, black males or black gay males or Hispanic males, and then white males that are leading in the top three. That's not the case anymore. Right now, in the top three are black women. Black cisgender heterosexual women are in the top three communities and populations that are impacted by HIV. And so the lack of knowledge and the awareness, and I'll use the word ignorant because it's not a bad word. It's just simply that people just don't know and they're
Yeah.
far removed from it because of stigma. It's like, and then the last thing is it's everybody else needs except me. Everybody else can be impacted except me. Everybody else can receive a diagnosis except me. And so, what was most exciting about doing this panel and this podcast this evening was that it is Black women, and it is a room of Black women that should understand that heterosexual men get diagnoses as well, and Black heterosexual women get diagnoses. And in 2024, Black women are in the top three. And so, what has happened over the years is that we go through different sectors. Okay, oh, it's Black men, let's target them. Oh, it's Black women. Oh, it's Black, Hispanic people, let's challenge them. And so now we're always behind the curve. But if we do what Family Services is doing a great job with, in this lead a status neutral environment where people can understand that regardless of my status, I can engage and I can have preventative measures, or I can get measures that treat me after having a diagnosis.
And this is reminding me, last year we were at the World AIDS Day Gala, and it was a Black woman that was speaking. I can't remember her name, but she said that I was married and my husband brought it home to me. She said, I didn't do anything wrong. I wasn't out in the streets. My husband brought it home. Mm-hmm. So as Black women, what can we do to protect ourselves? Because if you are married, most likely you're not using condoms.
Yeah.
I'll share a story with an advocate by the name of Gina Brown. And the lady you're talking about is the amazing Sharon DeQueer, who's an advocate who's based here in Baton Rouge as well. But I remember being at a meeting, and there was a lady who said, I don't need it. I don't need preventative care. I don't need to have this conversation because I'm married. And so the conversation that Gina had was, I need you to know that it only takes 15 minutes. It only takes 10 minutes. It only takes 5 minutes, because do you know where your husband is at all times? I'm not at all suggesting that infidelity is for everyone. I'm not at all suggesting that. But what I am suggesting is when you go and get your annual checkup, why not do a test? If there's any inkling in your mind, if there's any doubt in your mind, as far as trust in your relationship or marriage is concerned, then you should get tested. It's a health issue, and it doesn't care who it impacts. It doesn't have a look. I don't, you don't see HIV on me, but I have a diagnosis. And so I think it's all about being responsible for your health.
Because if you contract it, you don't necessarily feel bad automatically, right? So you'll have it and you won't know, right?
No, when I was diagnosed and I went through what is called a seroconversion, that's where the antibodies, come in and invade and overtake your blood system, and that's where the diagnosis can show up. It normally happens, and the feeling is normally just a common cold or flu symptoms, and then after that it goes away, and no, you don't know. So you can think you have a cold, or you can think you've had a bout with the flu, when you really, that's the diagnosis, really like taking up residence in your body.
And so by the time,
I think the last time, I'm sorry.
I was just about to say, by the time you start feeling stuff and breaking down, it's kind of too late to do something if it gets to the point where you physically are feeling awful.
It
I
depends on
mean,
the
I
individual.
wouldn't say it's too late. It's
Hmm.
just the illness might has progressed. Last time I read something, I think some individuals can go 8 or 9 years before their symptoms fully rise to the surface. So what I advocate for, because I am a married cisgender female. However, my doctor stopped testing me for HIV years ago. And when we found out this was taking place, because of course I wasn't paying attention to it, but I said, well, So when I asked my physician, I said, why you stop testing me for HIV? She said, well, you're married. I said, well, what does that mean? I said, I'm not the only vagina in the world. My husband don't have the only penis in the world. I said, so what does that mean? She said, well, I didn't think you two needed. I say, instead of you assuming, how about you ask? So moving forward, we have a really great relationship now, but you have to advocate for yourself because
Yeah.
they won't test you at all. You have to advocate for yourself. I know Family Services, we provide free testing Monday through Friday. No ID, anything is required. You come in, 20 minutes, you got your results. Either you're positive, you're negative, whatever the case may be, we're gonna make sure you have the proper resources. If you need preventative services, we'll give you that. If you need case management, we'll give you that. Or you just want to kind of just sit with the information, we'll allow you to do that. We're gonna follow up with you though, but we'll allow you to sit with it. But you have to advocate for yourself. Do your research. I tell anybody, you can't expect nobody to take care of you like you gonna take care of you. So definitely just always just look out for yourself. Yeah.
And when I see HIV/AIDS awareness, sometimes I see hepatitis C included in that. Now, why is that included in that? Is it related, or educate me about hepatitis C?
From my vantage point, from my viewpoint, it's simply because a lot of the, um, I would say, behaviors intersect when we talk about HIV and diagnosis. And so a lot of people or persons who use drugs are generally the population that get a hepatitis diagnosis. And a lot of times they coexist together. And so now what happens is instead of trying to treat just one thing, we intersect the work so that we can treat a person holistically.
So you just include all the
Uh,
STDs kind of in the category. So that's like syphilis too, everything.
Yeah, because they
of,
normally travel in groups.
yeah, definitely recommend a full panel. A lot of times, what we're finding is that not just with HIV and other STD and STIs can tag along. It,
Hmm.
it happens. Hep
Oh,
C
you
is
can get more
predominantly
than
for
one at the
intravenous.
same time?
Yes,
Yes, ma'am. Yes,
yes,
yes, ma'am.
Oh, you're teaching me something
Yes,
today.
ma'am.
absolutely.
Yeah. Yeah, yes, ma'am. Hep C is predominantly for intravenous drug usage.
Hmm.
So that could be an individual who, could be a current addict uh, that also is doing other things. And not only could they could have had a dirty needle. So not only could they have gotten HIV, they could have got Hep C at the same time.
Or they could,
So it does happen a lot.
or they can be a drug user and a sex worker. So those two things like
Yeah,
coincide.
Okay.
yeah.
So tell me, let's go into specifically about the programs that you all promote in the community to help bring awareness. I know both of you have events coming up,
Mhm.
but in
Marvin got
addition
about
to the
12
events,
events.
I know, but in addition to the events, like Marvin, you have an organization. Valerie, you have a program in the community. So
Mhm.
we're going to talk about all of it. Tell me about the programs first.
Valerie, you can go ahead.
Well, 'cause so I'm at Family Services of Greater Baton Rouge, and every year we make it a point to showcase or spotlight HIV, the work that's being done, and we try to honor at least one person a year. This year we have the pleasure of honoring my soror. She's recently passed, Miss Hadea Broadbent. So we are going to be honoring her at our World AIDS Day event. Um, we we're going to have our regional coordinator kind of go over. So recently, 2023 statistics for Louisiana have recently been released. So we're going to be talking about that. We're going to be talking to individuals who, again, are advocates about empowerment. The wonderful Mr. Marvin has agreed to bless us with his information and some special things he's going to be bringing that we're looking forward to. We just really want to educate the community because HIV is not a death sentence. You can live, you can thrive, you can do the work. My biggest thing is just doing away with stigma. I can't stand stigma. So that's one of the things that we're really, really looking to push for our days, and just letting the communities lead the communities. Meaning, who else better to talk about HIV and what it's doing to the community than the community that's dealing with HIV? So I think that's some of the things we're going to be targeting. So I'm just looking forward to having a great time, and hopefully you guys can come out and come check us out.
Now, do you have openings still on your registration? I know you have to register to
I,
come, right?
yes, ma'am. I still have some openings.
Okay, and awesome. And this is a free event happening Friday, December 6th at the main library on Goodwood. And tell us
Yes,
about
ma'am.
you partnering with your sorority and your sponsors.
Oh, ma'am. I'm a diehard poodle. So, but to be honest, we have invited the Panhellenic, which is all of D9 organizations here in the city of Baton Rouge. So, we have some deltas, I have an that's a delta, some zetas. Our caterer is actually a zeta for the event. So, free lunch will be provided. It's going to be a lunch and learn, and we're going to have food, like want to take a plate home kind of food.
Okay.
We have some omegas, some alphas, some kappas. We're gonna put a little bit of everybody in the building. My grandfather, who's an omega, he's 90 years old. He coming. So yeah, it's gonna be a great time. So my sorority, like I said, they're going to they provided a few things. They did all the tech work for us, and they are doing the on-air piece for soror broadband. Yeah.
Okay. And so this is an annual event that you do every year?
But I think, from my understanding, this is the biggest that we've done. But I think I'm having such a great time with it. I'm getting such a great feedback. I'm pretty sure I'm gonna make this annually this size every year
Okay,
or
awesome.
bigger. Yes, ma'am.
Yeah, you got to keep us posted about next year. And so
I
Marvin,
will. Yes, ma'am.
you have an event coming up as well.
Yeah.
You have, let me pull up your flyer. You have a fashion show.
Yeah, it's the Red Dress Runway show. You know, one of the things that I specifically wanted to do, or that I specifically focus on, is what are the blind spots and what individuals are we not speaking to? A lot of times, I go to the conferences and, a lot of times we feel quiet. But this show is a bunch of phenomenal models, mostly Black women who have offered their time, their talent, and their fashions to come and walk the runway in red dresses. Kind of reminds me of you all when you all came to the gala last year, Shanice, and all of y'all. The 100 was there, and that was there at the event. And so we're gonna have models to do a runway show, and red, of course, is the advocacy color. We're going to have a live DJ. We have a live entertainment. And in between, much like TED Talks, we're going to have Red Talks. And we're going to share information about HIV criminalization, and all of the different intersections of HIV and how they impact the community. And more importantly, we're going to talk about how HIV impacts women, and specifically Black women, in this time and in this season, so that we can make sure that we offer supportive services to our sisters. So
And
that's going to be Sunday at 5 o'clock p.m. There is an admission fee. It's $40. We're at the Marriott on Hilton Avenue. The reason why we're trying, this is our benefit event as well. So what's Stigmocracy, the SAN organization, Stigmocracy Advocacy Network and Development, is an organization that I found. What we do in an organization is we offer support to persons like myself who are advocates, and also individuals that are living with HIV, to offer supportive services for personal care and self-care. And so what I've found over the past years is I'm not rich, but I have been supportive and help people find resources if I can't supply monies or resources to help them. And so as an organization that said it's time to scale up. And so this is also a benefit event so that when those individuals that have in the past come and say, hey, Marvin, do you have a resource or can you point me in the right direction? Then we want to make sure that we have some resources to serve individuals.
And I heard that you have a new music video out. Now, are you going to be performing at your fashion show event?
Everybody's asking me that, Shanice. Actually, I released a new music video on yesterday, which was World AIDS Day, and it's called Not the End. And it's basically a song that talks about that, diagnosis, that you can thrive beyond a diagnosis, which is my life story. I am not HIV. HIV just happens to be a diagnosis that I have, but we and anybody can live beyond it. For National HIV Testing Day in June, I released an entire project, a CD with 5 tracks on it that all focuses on destigmatizing. And I wanted to do music and I wanted to do urban, hip hop and rap. Go figure that, me rapping. But it came together. I got a grant to do it, and it's called Artivism. And so you take your art and you put it with activism and advocacy, and it comes together. And so my YouTube channel is The Marvin Anderson. That's where the video is streaming at right now, as well as my other video. I have 2 out. And then you can find my project Live Beyond the Red. It's streaming on all platforms. Or you can get to all of those places from my Instagram, which is The Marvin Anderson.
Well, that's awesome. And then I do want to plug that the 100 Black Women is a community partner for the World AIDS Day Red Gala happening Thursday at Capitol Park Museum.
Yes.
Now, this is an event with Baton Rouge Pride because, like you all were saying, they didn't want it to just be like it's a gay disease and wanted to expand the audience. Mm-hmm.
Right.
And was saying, Black women are one of the people that are being affected. So we're going to be there Thursday, and we're going to try and come there as many as we can. And we'll see, how my back is. I was telling Marvin before we started, I'm getting old and my back ain't acting like it used to. But we definitely want to come out and support everybody's because this is affecting our community the worst.
Yeah.
Absolutely.
Yes.
So we want to support everybody doing something positive. So as we close out, tell me what our viewers can do to support the work you're doing in the community. Like if somebody listening saying, well, I'm not involved in anything. I don't know anybody affected with HIV and AIDS. What can the average person do?
Well, first of all, you know somebody now because you know me. Right. Secondly, I want to applaud the 100. Now, I see a few people that are there. So I see Angela, my classmate. I see Notoria, my classmate. So, hey, ladies. And I also see Courtney. But the truth of the matter is that what you all are doing, I'm so honored, and I want to applaud the 100 Black women for showing up in number at the gala last year. And I'm gonna put the pressure on because I need to see y'all Sunday too. But it's those type of things that we need to see. That it's not just about a gay man. It's not just about LGBTQ community showing up in the space. Like you just don't know like how much power that brings for professional, educated, powerful Black women coming into a space saying we are here. We're here to support the cause. Because what that says is, I don't have to be an advocate that's living with. I can be an ambassador of this message. I can be an ally of this community to help get this work done. And so start there. Just start by showing up supportive. And what you don't know, questions. What you feel you don't understand, ask questions and gain knowledge. But the first thing, Shanice, would be to show up. So thank 100 Black women for showing up. I was so happy to see y'all last year. I got my picture. But just showing up. And I think we start right there to show up and to get this knowledge and to get understanding. The science of HIV was what I want people to know. And then I'll, let Velanie speak. One of the science is so far beyond what it was 20 years ago. Personally, I go and get a shot like every 2 months, and that's my treatment, right? I'm undetectable. Undetectable means untransmittable. If I'm in treatment and I'm taking care of myself, then I can't transmit. That's one. But then there's also PrEP that's available for individuals who feel like, I'm dating, I'm singling and mingling, no judgment, right? Then in that situation, you can get on PrEP. There's a medication you can take that will prevent you from getting a diagnosis. And so all of these resources are available at Family Services, who was actually where I first had case management at when I received the diagnosis. So they're family to me. And I also filmed the video you saw there. So, it's all of those things that I want people to understand. But the main thing I want to say is your presence means much, and you showing up means most.
And somebody in the audience asked about young people. What are your initiatives doing specifically to target young people?
I saw that. That's my classmate, Glen Oaks, Oaktown. But to answer that question, on Sunday, because we understand we're partnering with an organization who teaches medical students in the Baker area, and they're going to be in the building, and they're going to actually be there. We're having a youth panel. We're having a conversation with youth to talk about the intersection of HIV and in their schools and in their community. And so those are the type of things that we are doing. Those are the type of things that we can do. And I also know that Family Services, I know they used to have a youth group, because I've spoken to them before, that they call their Family Services. And so it's all about engagement.
And
Yeah.
Velanie, what are
Yeah.
y'all
So
doing?
Family Service, we I'm sorry, girl. I'm a Libra. That's what we do. I'm sorry. Family Service, we do still have our youth program, which is called Red Ribbon. That is for individuals who were either born positive or obtained it under the age of 18. So we do still have it. Now, we don't have as many participants as we used to have, but that's because a lot of these individuals are not, you rarely hear about somebody being born positive now. It had to be some kind of situation where the individual just wasn't able to get the care they needed. But we don't have a lot of kids in Red Ribbon anymore. I know some things that we do. We believe in going out and meet people where they are. So we do surveys. We ask like, hey, what kind of things do you guys need? What would be good days for us to come? We ask. Sometimes I think if we can get back to just having simple conversations, being on the side of the road, talking to somebody. You don't know why the person on the side of the road. You know, I tell people everything is not always mental. Sometimes things be happening in life. I'm gonna talk to you. We do pop-up tents throughout the city. We are getting more and more into the rural communities who normally wouldn't have access to these kinds of services. So we want to make sure we're getting into these colleges. We are working hard, and I mean hard, to get into these high schools. We are getting a bit of a backlash for it, but we're working hard. We're not able to do any testing, but they'll let us at least talk to the kids. For a long time, we couldn't even do that. So more or less, we just kind of see what the need is. I do like that you can now test at a much younger age. So that allows us to gravitate to those younger kids who might not feel comfortable with talking to their parents about, or guardians about, anything dealing with sexual contact and just different things like that. So, they're able to speak to us on a more one-on-one basis. And if I know I'm doing the work, I understand, I'm a parent, I get it. But if I'm helping that child, I'm fine with speaking to them one-on-one. I'm giving them the resources that they need. Again, I'm giving them preventative care if needed, or if they positive, I'm gonna get you in regular care. So it just contingent upon, what's needed in the community. But like I said, one thing in Family Service, we believe in surveys, and we gonna ask you. I'm gonna come to you. Want to know what it is, and we're gonna try our best to accommodate any and everyone. We try our best to also keep resources on us, because sometimes an individual not thinking about their health and whatnot, if they have a trouble paying their bills. If I can help you pay your bills, and I know you were like, okay, I could take a deep breath. I can breathe now. Let me see what I can do about getting tested, about doing what I need to do to move forward in my medical care. So we just try our best to just, be that advocate, and help them empower themselves in whatever capacity that is needed.
Are the medications expensive for HIV and AIDS? Because when I hear like the president talking, they're always talking about bringing down the price of insulin, but they never say anything about medication for HIV and AIDS. Is it affordable? Is it high? How do you?
It is, whoa, very expensive. It's ridiculous. It's ridiculous. Ain't no way. It's we get special funding at Family Services just to help those individuals who may have an issue, whether they don't have insurance at all, or they may be within that gap to there. It's been approved but hasn't started yet. You'll be surprised how much monies we have to kick out to help these people, even if it's just a 2 week supply until they get their regular supply. Thousands of dollars.
A month?
We don't know why it's like
Yeah.
that. Yeah, yes, ma'am.
Yeah.
Yes, ma'am.
However, a person who receive a diagnosis or someone who want prep for preventative services shouldn't be alarmed right now, because there are programs that pharmaceutical companies and LADAP and ADAP and like all of those programs, there are programs to help an individual get medications, but they are extremely expensive. So I see Nina Hunter. So Family Services is a conduit of the Ryan White program, but they are not the Ryan White program. So Ryan White program is a program that is offered through different agencies throughout the city and throughout the state, and is actually a program that is federally funded, that can be offered by different ASOs, AIDS service organizations, or CBOs, community-based organizations.
Now, Marvin, you were appointed by the governor to the Louisiana Commission on HIV and Hepatitis C Education, Prevention, and Treatment. Now, what is currently on that agenda? And congratulations, by the way.
Yes, so I was appointed by our outgoing governor before he left, and that program basically is a board. We work in tandem with policy, with a lot of the policies. One of the things that we can this is a whole conversation by itself, but we specifically focus on policy that surrounds individuals living with HIV. Specifically, we have one right now, which is HIV criminalization. In the state of Louisiana, if someone says, just have to say it, they just have to say that I did not tell them I was positive or I exposed them, and then that can lead to incarceration, 10 years on a sexual offender registry, and that just messes up someone's life. And so that's the kind of work we do. We focus on policy on that board, and then also legislating and making sure that all of the regions in Louisiana and the state of Louisiana are in tandem relative to HIV care, resources, and supportive services.
The 100 Black Women Metropolitan Chapter has a public policy committee. How can we help you with that initiative?
Man, offering support. One of the things that we need are collaborators and partners and allies. It goes a long way. I think if we begin to look at this diagnosis as a community issue or a community matter, and it's not just for those people over there, because sooner or later it has the potential to be a knock at your front door. If it's not you, it can be a family member. And so I can't stress this enough, Shanice. I think just engaging and showing up like you all have done or like you all are doing, this is not a small thing to say, you know what? We are an organization of Black people that are professional, and, we're going to make HIV one of our pillars or one of our priorities. So for you all to host this on this evening and to offer this information to your community and communities connected to is really huge. And so this is where we start.
Yeah.
Yes. And you know what? This is a funny story I'm going to tell you. So last week or the week before, I was having migraine headaches. So I went to the emergency room, And they were trying to figure out why I had migraines, and they did blood work on me. And one of the things they tested me for was HIV. And so when I looked at the paper, I was like, why are they testing me for HIV? So I guess that's the stigma that I shouldn't have been kind of like, what I look like, why they testing me for HIV? Like I done been running the streets. I should have been like, they test that for like they test everything, like for diabetes, for high blood pressure. So it shouldn't have made me raise an eyebrow. That's what we want to get to eventually, right?
Yeah. I wouldn't have known. It was the same thing for me. I went to I had another health issue going on. I went to the hospital. They ran tests on me, and that's how I found out. Other than that, I wouldn't have known. So, and because we're in Baton Rouge, and because we're in the state of Louisiana, because just like you said at the beginning, how the numbers are and where we rank, then, at one point, that's what hospitals and that's where doctors, like it was on their, it was a priority to test. And so perhaps we're back in that space, but no, that's a good thing. That's a good thing.
Definitely. Yeah.
Yes, somebody asking, are the numbers going down in Baton Rouge?
Velanie, I'll let you take that.
Are you speaking of as it relates to African American women or just overall?
Either one. Is any of the numbers going down?
I do know that African American women's numbers have increased. Caucasian women increased, Caucasian women numbers have increased as well. We're not talking about that though, but they've increased as well. But again, however, I don't want to put it out there as if we just found all these positives. It's not. We test a lot here in Louisiana. This is what you want. You want people who's going into first of all, people gonna do what they want to do. We could tell people all day, use condoms, use PrEP, use this. People gonna do what they want to do. It's our job is to advocate, to empower these individuals to get tested, live healthy lifestyle. But if they don't, we also need to be there to make sure they're getting care, getting their proper medication, doing all these other things. But we test a lot here. So even though the numbers are increasing, that's because we are finding those individuals who are not testing. I would say about maybe 2-3 years ago, there was a survey going around. A majority of doctors in EBR were not testing for HIV/AIDS for any ER, like regular medical services. So I think, I'm not sure if Marvin was a part of this, but I know we have every manager, every coordinator, every director, everybody had to call like 5 or 6 physicians in the city of Baton Rouge and ask them, do you test for HIV or AIDS if somebody comes in for medical care? Me, myself, I had to call 5 and all 5 of them said no. So then we came up with like a bylaw thing. We was calling everyone and we kept calling them. I do know for a fact that 2 of them do now test for HIV/AIDS, regardless of what you're coming in for. So again, we have to advocate for one another. But yeah, the numbers are still high. But again, we test a lot. So it's like, you get it? It's like,
so
I can't really complain because we're doing the work. We're doing the work.
So I see those 2 questions I want to respond to, but I wanted to respond to the numbers. So just like Velanie said that with Caucasian and Black women, the numbers are up. However, in communities of same-gender loving, LGBTQ or gay men, the numbers are decreasing. And that happens because we have not been doing what family service is doing, which is, status neutral care. The second thing is someone asked if the Pep Up, Step Up is a negative or a positive impact as far as like HIV is concerned. And I don't know if they're asking this, but I'm going to say I remember when I first found out about PrEP, it was my own mindset that says, oh, people are, PrEP is available, so people just gonna do anything. They just gonna go buck wild, but that's not the case.
Yeah.
Studies have proven that people who are on PrEP practice more responsible
yes.
practices. as far as their sexual health is concerned.
And explain what PrEP is to those of us who don't know what it even means.
It's pre-exposure prophylaxis, and PrEP is a medication that you can take. It's a preventative care that you can take for to prevent from getting a diagnosis with HIV.
So you take PrEP before you even get it.
Yes.
Yes.
Prevent.
Yes.
Prevent. Yes.
Okay.
And a lot of people say, will it make you sick? I mean, medicines have different effects on different people.
Yeah.
And then some people even think stigma is so crazy. Some people, if I take PrEP, that's going to give me HIV. That is absolutely,
Yeah.
absolutely not the case. You know,
I ain't being nobody guinea pig. Oh yeah. We hear it all. Yeah.
Yeah. And that comes from a lot of medical mistrust in the Black community, you know, but
Yeah.
So we're going to wrap this up, but we got questions coming through and engagement. And this has been a good, like I've learned so many things from you guys.
We got to answer the questions.
She said, what can I do with your organization and who do I call to help?
Well, I know with family service, you can definitely reach out to me. Like I said, I work on both sides of the program, prevention as well as Ryan Wright. I don't turn down anything. So if you want to come through and help us with community events, you just want to learn. If we even family service is one of the locations in Louisiana where you can even get certified to test. So that's something that we can hook you up with. I am able to do observations after you finish the classes and you pass your exam. So we make it a point to not only get you the information, educate you, we make sure you are extremely prepared before you go out into the community.
Yes.
Thing that I want you say, if you offer this, I know agents this, but you know, I think as 100, you know, you can be a community provider. What that means is you can be a site that there are take-home tests now. There are tests that people can get that they can take home. I don't know if Family Services provide, but I do know that Metro Health provides those tests, take-home tests that you can pick up. You can take them home in the privacy of your own home, and you can find out if you know what your status is. And so those are available, I know, through Metro Health. You know, to find out what your status is.
And what you do on the take-home test, because I know it in the clinic is blood. How you test at home?
It's almost like it's almost just like the COVID test.
Oh, okay.
Mm-hmm.
Okay. Yeah. See, I'm learning all kind of stuff today.
and if someone wants to support,
and they free, they are free.
Yes,
you can get them on site. Yeah.
If someone want to support the SAND organization, Stigmocracy Advocacy Network Development, the first thing I want to plug this, Shanice, because I didn't say this. If you need to get a ticket to come vibe with us on Sunday, you can go to reddressrunway.com. So that's reddressrunway.com. And if you go there, it'll tell you, you know, where you can find us elsewhere as well. Yeah.
And so in wrapping up, first I want to say both of you need to be at the 100 Black Women Health Fair next year. We have an annual health fair, and it was big last year, and it gets bigger and bigger every year. So definitely, I'm inviting both of you to be a vendor and have a table. And
we would love to come.
Anyway, we can collaborate. And again, I think we're going to try and make all these events if the Lord says the same. And I just enjoyed talking to you all. So, final words. Tell me the final message you want to give to the community tonight before we go.
I think mine will be, instead of judging each other, let's love and embrace each other. None of us are the same. And I think that we learn to love each other for our differences. I think this world will be a much better place. And just stop judging each other. I'm like, I think if we can kind of get past that, it'll be a much better world. Yeah.
You know, I just want to encourage individuals to follow the template and follow the leadership of this organization that is in the community, to plug in, be present, engage with organizations like Pride or Family Services or the SAN organization. And I also want to press, because we're in the South, we're in the Bible Belt, and we saved and we love the Lord, and that's a gay disease, and we know that that's not true. So I want to challenge people to change their mindset. that HIV is not, it is absolutely not a moral issue. It is a health issue. The young lady that Velanie is honoring at her event this week, Hadia Broadbent, which is a national advocate who has been on the Oprah and all those places, she did not do anything. She was born. She was born with the diagnosis. So there are many different ways you can get a diagnosis. So it's not connected to a moral issues. It's connected to a health issue. So I think if we approach it that way, then I think that we can destigmatize and then finally share the knowledge you know. So if you're on this call or if you're here and you know knowledge, when you hear people in the salon or when you hear people in your family saying they got that stuff or they got that kit, all of that kind of stuff, then correct people, share the knowledge you know. You know, if people
Yes.
talk about, oh, you know, you're gonna die. Share the no, we had a podcast and we were informed you will not die. You can live beyond this diagnosis. And so
Oh, yes.
lastly, I just want to say thank you so much, Shanice, for this opportunity to be on your platform. And I want to say thank you to the wonderful Black women for engaging and showing up in space. Thank y'all for that. You know, you're the template, you're leading the way, and hopefully other Black organizations or, you know, I know the Delta do stuff. I know your organization, Velanie, does things. And so I am just really excited to see all of the Divine Nine and organizations like you all, Shanice, that are saying, you know what, this is our community because this epidemic is impacting Black people more than anybody else because of the systemic issues. So I just want to say thank you and really thank you for this opportunity.
Well, thank you guys. This was an awesome show, and definitely whatever I can personally do to support y'all, what the 100 can do, we're on board because we are here to advocate for Black women and girls, but for all Black people. So thanks again for this information, and I hope to see you this week.
Yes.
Yeah. All right.
And it's
thank
okay
you,
to,
guys.
it's
Y'all
okay
have a
to focus
blessed
on
night.
Black women and girls. It's okay. You can do that. That's what you and your
Yes.
All right. Well, you guys enjoy the rest of your night.
All right. Thank y'all so much.
All right. Thank you. Be blessed. Thank you.
Bye-bye.
Bye-bye.
And so we are going to, I'm going to recap the events before we go. So Thursday, we are going to be at the World AIDS Day Red Gala. These tickets are being sold on Eventbrite. Get your tickets, and we have that link on our social media, on the 100 Black Women social media page. There's going to be food, entertainment, art. That's Thursday. Then Friday, we have Velanie's event with the family services. This is a free event at the main library at Goodwood, and she says they're going to have food there too, so everybody's having food. And then Sunday, the grand finale is Marvin's event, a fashion show at the Marriott, and you purchase tickets from his website, reddressrunway.com. So we're going to try to support as many things as we can and advocate for health in our community. So thank you to my guests, Velanie Taylor-Orange and Marvin Anderson, for being my guests on the show this evening, and for all of the phenomenal work you're doing to stay up to date with everything Metropolitan Baton Rouge chapter is doing. Visit our website, ncbwmetrobr.org. If you want to support our work in the chapter, you can give us a donation through the website. Just go to our website, click on the donate tab, and give us some money for our programs. And you can also email us at info@ncbwmetrobr.org. I've been your host this evening, Shanice Lewis, on behalf of the Metropolitan Baton Rouge chapter and President Courtney Hunt. Thank you for tuning in for Keeping It 100 Coalition Conversations. Until next time, be blessed.